Thank you for meeting with me, Dr. G. We are putting together a small video to explain how practitioners at the IHM take the case of sick people.
I always find that particular question a strange one.
Oh? Why is that?
Over the years, homeopathy has digressed from the roots of the founder, and it is sad to see the deviation from the instructions given for case taking. So when you ask how we take a case, the obvious answer is exactly as Hahnemann instructed in the Organon. The problem is that in the West, many people have not read the Organon, and for those that have looked at it, there is a spiritual Kantian overlay which masks the directions that Hahnemann gave. Hahnemann said to compare the current state of health with the normal state of health of the patient. These are aphorisms 5 and 6 in the Organon. Many people make the mistake of thinking that an investigation into health involves prescribing for the personality and mental state above all else. Aphorism 6 makes it clear that it is only the altered deviations from the prior state into a disease picture.
So what about the statement in 211? This holds good to such an extent that the state of the disposition of the patient often chiefly determines the selection of the homeopathic remedy, as being a decidedly characteristic symptom which can least of all remain concealed from the accurately observing physician.
I would refer you to the previous aphorism of 210 to see that the context is referring in the main to mental disease.
So, do you take the disposition into account?
Of course we do. If it is altered from the normal state of being, either by symptoms being exaggerated or changed, we will see it as an expression of the disease state.
So what are the most important symptoms in case taking?
Hahnemann looked for the expression of the disease. That means looking how the patient exhibits the symptoms individually. In a disease state, say like influenza, some patients have an affinity to bone aches, some to fever, some to other things. Each expression is different even within a disorder of known pathology. Sometimes the body produces symptoms not known to be associated with a disorder, yet are present in the patient. We look at each symptom and make sure the components of it are covered, the location, the nature or sensation of the pain, and modifying factors involved to aggravate or ameliorate the symptom. By then reviewing all our findings, we are able to trace the core expression of the disease that are matched by a medicine that can produce the same state in a healthy person.
Well, thank you for talking to us. Much appreciated.